everyone. My name is Darlene Young, and I'm host of the show Mindful Health Alternatives that appears here monthly on CAT TV, Channel 15 in Bennington. The goal of the series is to introduce you, our studio audience, to a less stressful lifestyle through several different methods. Our guest today is Victoria Irwin from Vermont Reflexology and Massage, which is located in Chittenden County, and she goes around and does home visits, reflexology and massage, and also hospital visits. Welcome, Victoria.
Thank you.
Glad to have you here. And she drove like 2.5 hours to get here, so, you know, and it was a really good day, so yeah, we lucked out on that. And we also have Suzanne Jones from Bennington here in the middle. Suzanne's going to be our model, and Victoria is going to practice a little bit of reflexology and a little bit on Suzanne. So without further ado, I just want to welcome Victoria again. And she's going to tell you about the art of reflexology. She's brought a foot model with her also. She's brought some charts, and she's got lots of answers to questions that I have, and we'll see what happens.
Yay.
Victoria, take it away.
All right. Well, great. I'm really happy to be here to represent reflexology, to stand up for it. It's a beautiful system of relaxation, body work that's non-invasive, profoundly relaxing, and just really can help anybody.
That's good. That's very good. Now, how did you get started in reflexology?
Well, it's a long story. You want the short story or the long story?
Whatever one you feel like telling us.
Basically, I was in massage school, and I'm a person who likes to work with my hands, and I was an art teacher, and that wasn't quite what I wanted to be doing. So I was in massage school, and as soon as I received reflexology, I just couldn't believe it. I was just like, oh my God. I was moaning and happy. And I was like, you can make a living doing this? This is great. It really resonated with me because I always had foot pain problems, uncomfortable shoes, and I was flat-footed. My feet would fall in. So it was a real eureka moment.
That's good.
For me.
That's good.
Yeah.
So you decided to learn how to do it so you could give other people the benefit.
Yeah, it was just one of those things that just stuck.
Okay.
And it really helped me get rid of callousing and chronic pain.
Really? And
help my arches come back up, because my arch, basically, with flat feet, your spring arch is broken.
Okay.
Which I can talk about a little bit more later.
Okay.
Yeah.
So how long has reflexology been around?
Well, there are centuries, actually. There's the furthest evidence that we can find in our paperwork of history would be this picture from the Egyptian tomb of the, oh, you're going to hold it?
Sure.
It was in the physician's tomb, this painting on the wall, and basically if you can look at it closely and see that someone is receiving hand and someone is receiving foot reflexology. So that's like the furthest back piece of evidence we have. There's lots of other historical information and little bits here and there in multiple continents. So without like talking about history for hours, basically, modern day reflexology is what shall I say? We're working on the model based on the work of, I could mention like 3 or 4 people. So William Fitzgerald was a doctor. He was a UVM graduate, actually, in 1895.
Okay.
And he did surgeries, nose and ear, and he kind of stumbled upon this technique. He didn't really create it, but he kind of adopted it, because in the other history that was going on, there was something called zone therapy, which I can basically show you if you look at these two pictures. There's this, so you could see there's 10 vertical zones in the body. Also, a close-up of the feet. This would be the bottom of the foot. These are the same 10 zones. So he stumbled onto this schematic, if you will, of healing touch within those zones. And basically he found that anything working anywhere in a zone, and you can also have that mapping on the hands, anything working in, say, the 5th zone would affect anything else in that same zone.
Okay.
So that's zone theory.
Okay.
He didn't practice reflexology. He was a surgeon. He would use really strong pressure with metal tools and wooden clothespins and metal combs to apply. And I don't have lots of information about how he did it. I've seen some pictures with them on fingers, but he would apply constant pressure, and that would create a numbing effect in another part of the body, so that he could do surgery, minor surgeries. I don't really know exactly how many kinds, but he did perform some surgeries without anesthesia or very little.
Okay.
So that's like, wow. And he brought this into contemporary society, and there was a lot of controversy over it. And some people were open to it and picked up on it, and other people probably thought he was crazy. But yeah, it was pretty amazing.
Well, that's good. So he was sort of like a forerunner of the reflexology.
Yeah.
Okay, good.
Yeah.
Okay.
And then from him, I'll just do a little historical bit.
Okay.
And then, so Joe Shelby Riley was also a doctor. He had a chiropractic school. He studied medicine, surgery, osteopathy, naturopathy, and he was also interested in physiotherapy and the zone therapy and color and light therapy. He and his wife were interested in things that were drug-free, just helpful modalities. And he actually built upon this model by creating, I don't have a chart of his, but he, within these longitudinal, that's longitudinal, right? Yeah. Within these longitudinal zones, he would map out, okay, so the brain, the neck, the heart, reflexes, the stomach, intestine. So he would map out where the rest of the body parts fit in within those zones.
Right, so he sort of like made the puzzle of the whole thing. Okay.
Yeah.
Alrighty.
Yeah. So he made the first detailed diagrams with those body parts put into that system. And he practiced zone therapy as well. He also included auricular therapy, which is based on a mapping of the ear with the whole reflexology map, which I don't have a schematic of, but basically if you thought of like the earlobe as the head and this as the spine, that would be your mapping of where things would be. I suppose I should just give you the clinical definition of reflexology, the pragmatic view of it, because basically reflexology, I'm using the ARCB definition.
Okay, and what's ARCB?
Oh, that's the American Reflexology Certification Board.
Okay, good.
Which is a professional organization that promotes professionalism in reflexology.
Okay.
So, I mean, there's so many descriptions of what is reflexology that I just wanted to give you this one because it's real clean and simple.
Okay.
So it says reflexology is a non-invasive, complementary practice involving thumb and finger techniques to apply alternating pressure to the reflexes shown on the reflex maps of the body located on the feet, hands, and outer ears. So so if Joe Riley put these, he put an area for the lungs and the brain and the intestines, those would be the reflexes.
Okay.
It's not your actual brain. We always call them like the brain reflex or the shoulder reflex.
Now, when you go to these zones or areas, you can tell different things are going on in the different parts of the body?
Well,
or
What-
that
what
help
a-
is needed or something?
Yeah, that's a good question. That's a common question. So basically, what I do as a reflexologist is I provide comfort
Mm-hmm.
to the client,
Okay.
soothing touch. I take a thorough health history. I find out what someone's complaint, problem is, or concern, and I approach the foot always thoroughly. I always touch everywhere on the foot,
Mm-hmm.
and what I'm trying to do is listen to my client and provide that comfort of touch in a thorough way. So I'm getting everywhere in the foot and I'm feeling for something that might be different,
Okay.
like a hardness, a
Mhm.
crunchiness, or a hollow,
Okay.
or, you know, they wince, or they, God forbid, they scream. Or they may go,
Excuse me.
oh, wow, I never knew. Or they might just feel like that is so significant, that's so meaningful.
Okay.
And so I'm looking for those places that really resonate
Mhm.
with the person. And what you find is that, oh, somebody with, you know, neck aches or something, when I get work in the toes, they're like, oh, you know, and they feel a lot.
Mhm. Mhm.
So you match up what you feel with the touch with
Okay.
what they're saying and complaining of. And a lot of the times what my practice is I'm asking questions.
Mhm.
I'm helping bring awareness to you to say, oh, interesting. So this lateral side of your foot, you know, actually relates to your shoulder and your knee and your leg.
Mhm.
And, you know, say you've had knee surgery and you're like, wow, that's really a lively spot.
Mhm.
So, you know, I would work on it to your tolerance and comfort. And yeah, the stories of how the theory matches up with reality are really pretty interesting.
Okay. Good. Now, a lot of you might have heard about reflexology and thought that perhaps it was just for the feet, but Victoria has brought it to my attention too that it's not just for the feet. There are practitioners that work on hands, practitioners that work on your ears, and also practitioners that work on the face. So, for all practical purposes today, it's basically going to be the feet.
Yeah.
Yeah. So that's
Yeah.
good.
Yeah, if something comes up and I want to go to your hands, that'd be okay with you?
Be fine.
Okay.
Okay.
I could say too that Eunice Ingham, she wrote this book, Stories the Feet Can Tell Through Reflexology and Stories the Feet Have Told Through Reflexology. And she was really quite, I think, an amazing person. Like most women, she was really wanted to empower people and help people and give them tools, and like she was like kind of like a perfect mother in that way. But she worked really diligently to provide really specific notes to prove her findings about reflexology for the medical world. She wanted to be recognized by doctors to say, you know, look at this, I've done this. So her stories of clients and what they say and what she finds are really precise. And if you're at all interested in becoming a reflexologist, I would totally recommend this book.
Sounds like it's a very interesting book.
Yep. And she found that using alternating pressure, because she was a student of Joe Riley, who was connected with William Fitzgerald. And, you know, they were doing like that zone therapy where they're just pressing,
Right.
you know, holding like the metal comb against the foot or the finger to
Yeah.
create an anesthetic effect. But she was saying, well, alternating pressure would actually create a more healing effect on the associating organ, the reflex with that body part.
Right, because it
that clear?
probably would stimulate blood flow to the part rather than, you know, just taking a metal thing and holding it there to create numbness.
Right.
Yeah,
That's
okay.
that's a smart way of thinking of it, yeah. So the other thing was she talked a lot about the delicate nerve endings in the feet
Okay.
and how when there's stress in the body, I mean, it gets a little mystical at this point, but basically if you believe in this mapping, And if you, everyone has stress in their lives, in their bodies. If, say, you have a stomach situation and the, so that reflex could become, like the nerve endings that respond with that reflective organ would be sensitive. The question often comes to in my mind is like, well, what happens first? Do the bones in the feet move in a certain way to create stress in the foot, which then connects with the kidneys or the liver? And she talks about that, and she talks about clearing the delicate nerve endings of the specific reflexes. And like I said, she worked really hard to go through the foot, and she says, no, the spleen reflex is fine, and it's here, and the gallbladder, and she just really had a very amazing way of really searching and working things out that way.
Now, like when you said like she was, feeling the reflexes and things like that, if you went to her or to you and you were having issues like with your shoulder or something, and you could work on that zone or that reflex that is attached to the shoulder, would it help to relieve the shoulder distress that you're experiencing?
Well, yes, it
Maybe?
can.
Yeah.
It can. And in her stories are very direct. Like she says, yes, I've done this, and this was the problem. In my experience, she was kind of working more with a medical, more of a medical model. I say that because she kind of came from this lineage of the doctors who, so for instance, I'll read you one thing that she said, because is it okay?
Sure.
I think where's my glasses?
Sure.
I think it's really interesting. Here she says, perhaps a sluggish liver is responsible for the trouble in the intestinal tract that results in constipation. Can the feet be made to tell the story so that the cause of that constipation may be found? Let us see if we find the nerve endings in the right foot reflexing to the liver very tender. If so, we know there is a crystal-like formation there interfering with the circulation of the blood to the liver, preventing it from functioning normally. As we work this out, we are giving nature a chance to carry away the waste matter and restore the normal circulation to the affected parts or affected part or parts.
Sure.
So it's that kind of thinking.
Yeah.
I'm just seeing if there's any other really great.
Sure.
I love reading the way she writes because it's different than the way people speak now.
Right.
It's kind of nice.
So there are different pathways so that like the liver would be, how do I want to say, connected with the intestine. And if it was a sluggish liver, then chances are if you worked on that zone on the foot, you would sort of give the liver a little bit of new energy, if you will.
Yep.
That's good.
Yeah.
That's very good.
Yep.
Good.
Yeah, you could talk about it that way. Yeah.
Okay.
And there's an interrelationship with the body systems. So we have a digestive system, circulatory, lymphatic, endocrine, nervous, muscular, and skeletal.
Okay.
So all these things come together. So if you come to me and say, oh, my shoulder, I'm going to look at not just your shoulder, but I'm going to see, okay, is there an injury? Is there a surgery? Is there something going on with your lungs or your neck or your spinal reflexes, which relate with that part of your body? So you're always looking at the whole picture from all different avenues. And so the liver affects, what the hormones and what's released and how things are all flowing. So it's having that sort of body sense awareness that it's a whole big picture, which is what the American Reflexology Certification Board really does the training with that in mind. Okay. So they want practitioners to know, like, you just don't, someone says this part hurts or person has heart issues, they're not going to just, ream on that spot. They're going to kind of look at the whole sensitive picture of a whole body. And Yeah.
Now, one of the things you mentioned to me was passive foot mobilization.
Yes.
Victoria, can you sort of like enlighten me on that one, please? Because I'd never heard of
Sure.
it before.
Yeah, I will. I'd love to.
Thank you.
I'm gonna just move this out of the way. So I'm gonna show you some bones.
Okay.
Each foot has 26 bones in our feet, and so passive foot mobilization came from Dr. Wickler, I believe it was, and also I found this book by Dr. Hiss, who talks about foot function.
Okay.
And I'll show you a picture here. So this is a picture of a footprint of a fully functioning foot.
Sort of
whole-
like it used to be on your birth certificate. So you used to have
Right.
pictures of your
Right.
feet on your birth certificate.
So the whole plantar surface of the foot is showing,
Okay.
okay, because the person makes complete contact and pushes off. So this, in contrast, is a picture of the people who would come to his office complaining of pain,
Whoa.
their footprint.
Yeah.
So you could see that they're not actually using
Yeah.
the lateral side of their foot and their toes. So they're toeing off, as we call it, from the great toe.
Okay.
So the implications of that are that the shoes, he talked a lot about shoes being, these women, mostly when we would come in with these squeezy little shoes with high heels and, you know, complaining of all these pains. And he goes, well, listen, I'm going to fix this and you got to get new shoes. So if they were willing to get new shoes after he worked on them, they were better without pain.
Sure.
But some people didn't want to do that, which is often the case. But anyway, so he basically talked about the muscles that hold bones out of alignment, and well, he was a doctor. He could do surgical procedures. I don't do that. But it draws attention to the fact that, okay, if you have shoes that are squishing your toes into a point,
Right.
they're not too long, so this toe pushes back. Hope you can see what I'm doing. Or you are maybe forced to walk too soon when you're a baby and your bones aren't formed and you just like your arch falls.
Okay.
So this should be the spring part of your arch that gives you your ability to bounce and to get like that effect when you're walking. So if these bones, these tarsal bones, are all properly aligned and free of tension between the joints, you're going to have a healthy foot, healthy, fully functioning foot, and you'll have that spring arch with that bounce. But a lot of people will have the flat foot, they'll have like a collapse.
Right.
So with passive foot mobilization, I would work a full reflexology session, which is basically, like we said, normalizing the tissue, touching everywhere on the foot, zoning into places that are a little more tender for you or just more meaningful, and creating a sense of clearing and wellness through that. And then with the mobilization, there's work on the calves and some more energetic movements on the feet, which are not
Wow.
really reflexology,
Okay.
but they're basically to get at releasing tension at this joint level. These are the phalanges, okay? And these are the metatarsals. So you want to get at this joint level,
Okay.
and you want to get at this joint level. And then, so basically, pretend this is a foot with a person attached. So I would be doing some circling, some moving up and down, some gentle pushing. And I'm always working to comfort, to like the feeling, like, yes, that's helpful.
Okay.
I'm not pushing bones. I'm
Right.
not a chiropractor. Chiropractors can push bones, and they do.
Do they on the
But-
foot too? Okay.
But I don't do that. What I do is, you might sort of say that passive foot mobilization is like passive chiropractic.
Okay.
Because basically what I'm doing is working at a deep level of removing tension from the joints and the muscles and the tendons, so that when I do those movements, that, you know, the cuboid, when I'm moving it, can all of a sudden, like if it's like stuck like that,
Yeah.
it'll gently go in.
Right.
And sometimes you hear clicks. Sometimes I may work on people for 10 sessions in a row if they have a chronic situation that's been for years, which most of us have.
Right.
I remember this one client I had, after 10 sessions, she was at her desk one day and she said she moved her foot, pretend this is my foot, she moved her foot like that, and she felt this thing go brrr, and she said it felt great, and it was like, and she had no more pain anymore.
Oh, wow.
So it was a real aligning.
Yeah.
And so it's a real beautiful way to restore health to a foot.
Good. Very good.
Yeah.
And it's fascinating to know and to learn, that so much is attached to the feet, if you will,
Our whole bodies.
Yeah, really. I have another quick question for you, and then we'll wind down a little bit so you can show a demonstration on how reflexology sort of works and how it feels. Are there any contraindications for receiving reflexology?
Oh, good question. Yeah. So to be very conservative, which practitioners like myself want to and need to be in this world, in pregnancy, the first trimester, the ovary reflex is the ovary on the uterus reflex would be avoided out of over concern that you may stimulate a miscarriage.
Okay.
I've never seen it happen.
Yeah.
But that's a conservative approach, and that would be, if this is a foot, that would be the inside of the calcaneus, the heel reflex area.
Okay.
So you don't want to bring that on. Personally, what I believe about that is if there's tension there and it feels good, that you would work it and you would be fine. But I feel pretty comfortable with the fact of what I'm doing and that it's safe, and if somebody was really nervous about it, I wouldn't do it.
Right,
I would always defer to my client.
Sure.
Also, diabetics, you want to make sure that they can actually feel their feet. They don't have any open cuts, or because the neuropathy can be a problem, and you don't want to be working so hard on them that they don't even know what you're doing.
That you don't feel that.
Yeah.
Yeah. Okay.
Also, with diabetics getting treatment or having a session, you want to make sure that how they're managing their diabetes. Are they on insulin? And if they have a blood sugar drop, do they have like a cookie or a cracker in their bag? And because with reflexology, going into a relaxed state like that, when your whole endocrine system, if you're really relaxing, can really drop down.
Wow. Okay.
And the stress hormones that the adrenals put out, the cortisol, that make us hyper, and which also helps releases sugar into the bloodstream, so that can get turned down. So they may be on the table and all of a sudden feel like they need that sugar because you've relaxed so much.
Wow.
So it's a whole picture.
So that's why you have the client make out the sheet, so you can get a general knowledge of how they function.
If there's any red flags, you catch them. Also, if someone's had like surgery or cutting of the bone, or they have screws put in, then you would not do the passive mobilization until you were totally sure that it was safe and they were comfortable. And sometimes you interface with the doctor and make sure that everything's understood.
Right. Something else that Victoria brought along with her today to raise knowledge and about reflexology in New York State. Do you want to briefly just go over this while I hold this?
Sure. Yeah, I just read this on Facebook the other day. New York State is trying to, the organizations like the ARCB and other national organizations are trying to basically legitimize reflexology, make it more of a recognizable modality, and have them interface with doctors, and kind of like with chiropractors, like all of a sudden now they can get paid. So
that'd be good.
So if you're interested to sign this petition, it would help spread the word and spread the practice of reflexology, which really can help so many people, and I think help bring more peace in the world, because one pair of feet at a time, you know,
Yeah.
relaxing and honoring each other and comforting can make everybody less stressed.
Well, not only that, but a lot of these alternative modalities can do more for a person than what a pill or a shot can do. So,
I've often thought about that. I think we should move, but you know, like these rich people, like movie stars who wind up like dead because they take so many drugs.
yeah.
It's because there's so much stress in their lives, right?
Yeah.
And I often wonder, it's like, wow, if, you know, if Michael Jackson or Prince or whoever, these people, I just mentioned them because they have the money to get lots of reflexology. If they did that, they could have managed their stress and they could be alive. And I mean, that could be the case for anybody. You know, I mean, we all experience stress in so many ways. A lot of times with people, I get them on the table and they're like, oh my God, I didn't even know I was clenching my toes.
Yeah.
I didn't even know that I was so stressed. And they get to that level of profound relaxation. They're like, wow, this is a surprise.
Yeah. Yep.
So it's good to know that.
It is. Well, I'm really appreciative that you are with us today. And we're going to stop now for a little bit and rearrange. And Victoria is going to show you basically what a shortened reflexology appointment would look like, and get a little bit of feedback from Suzanne. And once again, just a reminder to our audience that before you try something new for an ailment that's been bothering you, always check with your primary physician to see if it's okay with them for you to give it a try. And I want to thank you all for tuning in. We are going to change over now for the reflexology demonstration, and we hope to see you again. Thank you. Well, thanks for waiting for us. We're all set back in the studio now with Victoria Irwin from the Burlington area. And our client today, our model, is our own Suzanne Jones from Bennington. And Victoria's practicing a little bit of reflexology on Suzanne, and will tell you what she's doing. Okay, Victoria, it's all yours.
Okay, welcome, yeah. So, Suzanne, I've made Suzanne comfortable. Usually in a session, you put a little something under the client's knees for a little flexion. She's wearing an eye bag. A lot of people like to just have darkness to relax, and also there's bright lights in here. So I'm just applying a very soothing full touch to the whole foot and ankle. And it's important for me to be relaxed and to breathe. And I'm just going to suggest to Suzanne to just let yourself be, yeah, you knew exactly what I was going to say. She let herself just drop into the table. Take a breath and just keep awareness of your breath and your comfort. She's in control. She knows herself better than I do. I am working on her ankles. I'm feeling some tightness, a little bit of clenching of muscles a little bit. So, but Suzanne has had some ankle surgery, right, Suzanne?
I've had on the right leg, I had a compound fracture when I was in high school.
Okay.
And I did break my left ankle about 14 years ago, but it didn't require surgery.
Okay.
And I just recently had, about 9 months ago, I had full knee replacement.
Okay. So Suzanne's got a lot of bone things going on?
And that was
History.
due to the, that was due to osteoarthritis.
Okay.
That I do have arthritis in my joints.
Okay. Are you feeling comfortable with the amount of pressure I'm using?
Fine.
Okay, good. So I also want to welcome her and suggest that she tell me if she doesn't like something at any moment. She can tell me that. because I can feel she's maybe not so sure about this. Is it feeling comfortable?
Yeah, it's fine.
Okay, good. So I'm just doing a soothing kind of, my thumbs are going from the middle of the arch out to the lateral side of the foot. And so everything that I do, I want to be soothing. My voice, the way I change position, rocking, whatever I offer her, I want it to soothe her. Sometimes a little jostling is nice. Is that comfortable?
Mm-hmm.
Okay. Sorry, a piece of hair there. So this is a short session, so I'm gonna just show you a few things that can often feel really nice. A little rotation of the toes, phalanges. Is that comfortable for you?
Yes.
Okay, good. So in a full hour session, I'd probably spend a good 15 minutes between the 2 feet just doing what I'm doing now. Is just really doing a very methodical, careful massage, getting the feet, I'm learning of the feet are learning me, we're learning of each other. And I can feel where things are a little bit like that, tight.
Clenched up.
Yeah, just like. So often when I feel that, I need to breathe more too. So just, this may sound crazy, or maybe your audience is familiar with things like this, but try to breathe into your feet. Oh, so silly. But maybe it makes sense. So I'm going to just slowly do a little thumb walking through the bottom of her foot. And again, is that comfortable amount?
That's fine.
Okay, good.
That's the ankle that I broke, and
Yeah.
I also, with breaking the ankle, I also pulled all the ligaments in my foot.
Oh, okay.
So
there's a reason why she's protecting. She's had some trauma here,
yeah.
right? Are you feeling safe in the amount I'm moving you?
Oh yeah.
Okay,
Yeah.
good. But good note to the audience is that, when you have trauma in your body, things can get stuck.
Yeah.
Things can stay there until you work it out and deal with it.
Because we try to protect it and keep it from hurting worse, correct?
Right. Habits too, just the habit of, she's got to hold herself together. She's got to function. So in Suzanne's case with a bone in the knee situation, I would just carefully try to just keep introducing more gentle movement at the joints to increase her functioning of her foot.
Mm-hmm.
Does that make sense to you, Suzanne?
Yes.
Okay. Are you liking this so far?
Mm-hmm.
Okay.
Now in back of Victoria on the window there, we have the graphics of the 2 feet and the zones of the body and how they correlate to the feet.
Right. So I'm working at her ankle, which is basically the hip reflex area. You can see it on the body and on the foot. So, yeah, her ankle's kind of tight. I can do a little bit of, is that comfortable?
Mm-hmm.
So I'm just mobilizing a little bit. I'm suggesting to the calcaneus, which is the heel bone, just seeing if there's any ability to move there. And she'll tell me if she really loves it, right?
Right.
Sometimes people say, oh my God, I never knew.
Well, I've also, since I had the knee surgery, I think I've been placing a lot of my favoring possibly favoring the knee for a while and putting more weight and more pressure on that left.
Oh, so you've been using this left leg more.
Yeah, I think so.
Well, that's good awareness, yeah. So that's something to keep paying attention to, especially.
And I definitely do not have flat feet. I have a high arch.
Right, yeah, I can see your arch looks not
Talking
flat.
about wearing uncomfortable shoes, certain shoes I was never able to buy because the top of the arch would be at the top of the shoe. It would along the edge. It wouldn't even be down in the shoe itself.
Wow, yeah. So this is a short session. I want to make sure that both feet get some
Attention.
attention. Yeah. So Suzanne, just take some deep breaths, okay? And even if you don't believe it, just say to yourself, I, can drop into the table a little more, or I can trust Victoria, I can let myself feel supported. Yeah. See,
I'm sinking further into the table.
I felt that, and it's funny, it's subtle, but I could just feel a little like, ooh, a little letting down.
And this can be totally relaxing. It's kind of difficult, I would think, laying on a table with a whole bunch of hot lights and cameras on you. So, there's a certain degree of relaxation that Suzanne probably won't find today that she would in, the, how do I want to say, the
Like
confines
a
of
full session,
yeah,
a real session.
Of an office type or her home setting.
Mm-hmm. So the reflexes I'm working on now are the upper torso lymphatic reflexes. I can just feel really nice, and my goal is to sort of try to get in between those metatarsal bones a little bit, just to feel like how much can I get in there, and then go across the shoulder line reflex here.
On the top of my foot there, between the second toe and the big toe, on top there, pushing down or going further up onto the arch, it seems a little sore.
Okay, so from here this way?
Yeah, right there. Yep.
Is that a comfortable level of pressure?
Yeah, it's just that I know you're definitely pressing in on there.
Mm-hmm. So what's your gut reaction? You want me to stop it, or are you willing to work with it?
I'm gonna go it for a while.
What, ignore it? Is that what you said?
Yeah.
Okay, thank you for telling me.
And this is what Victoria was referring to when she was talking earlier. It's important that the client communicate to the practitioner what feels good, what doesn't feel good, what's uncomfortable, what is comfortable, okay?
Yeah, developing that language communication is really important, because somebody could say, oh, that's really tender,
Yeah.
and they may not mean to stop. They might mean it's just tender and go for it. So you really have to have
In the right heel, I'll also say I haven't had it in a while, but I used to be bothered with plantar fasciitis.
right, which the passive foot mobilization can really be helpful for, because it's this whole fascial line of tightness all the way. Like I would work up the whole back of the calf, all around the heel, and in there, and then get movement and find the place of congestion and really.
No, Victoria, is that like with the Achilles tendon also?
Yes.
That hitches into
Yes.
the muscles and ligaments?
Yep.
Okay.
Yep. Yeah, this whole back of the legs,
Okay.
all the fascia and tendons and stuff. Right. Is that movement comfortable?
It's fine.
Okay. Have I converted you yet?
I think if we left her alone for a couple of minutes, she'd zone right out and probably fall asleep.
Probably.
That's what we call it, being in the zone. So when you drop down and are really in that, like you're not asleep, but you're not awake, that is the parasympathetic nervous system, the place where your body rests and digests and repairs itself, and that's the healing zone.
Yep.
That you want to get into. All right, this is a short session. Tell me, do you have any requests for areas for me to touch that I might have not gotten to enough?
Try the underneath my left foot, the toes underneath my left foot, right in that area.
Thank you.
That's generally where it seems to get numb,
Okay.
and that's the foot where I broke the ankle and tore the ligaments, and I just,
Right.
that, as I say, it's been a while, but
Okay, so tell me, I don't want to go too hard. You comfortable?
uh-huh,
A little pinchy? All right.
uh-huh. But I've noticed that my right foot seems to be doing almost the same feeling when I get into bed at night, but I'm attributing it to the arthritis, so.
And you have peripheral neuropathy in your toes too, yeah?
I have arthritis in my toes, yes.
Okay. I thought so it's a neuropathy kind of thing? Did you mention that? I thought you said that.
Yeah, the right foot isn't quite it wasn't doing that in the right foot, but now it seems to be in both.
So
But I do have been diagnosed about a year or so ago with diabetes,
okay.
but it's been pretty much under control.
Okay.
I'm not taking insulin. I'm only taking one pill a day for it.
So diabetics can get peripheral neuropathy, which is basically numbness in the toes. Sometimes I've heard the toes described as feeling like they're popcorn stuck on the end of their feet, or just like a dullness. And I've had a few clients where with consistent sessions they have felt a livening up of their feet, like a more of a connection, which is really wonderful to experience that.
Where you're pressing now, does it have anything to do with the shoulder?
Yeah.
Uh-huh.
Oh, you read my charts.
No. Well, yeah, I
Shoulder
did.
reflex.
I did, but
Are you feeling something with your
I'm
shoulder?
up in my left shoulder that
Yes.
really bothers me with the arthritis.
Yeah,
That's-
this is actually, exactly the shoulder reflex on the left side. And for me, what I feel is some, like a gritty, bubbly sense of stuff in there. And yeah, just to remind you, so working, whether it's delicate nerve endings that we're affecting or whether I'm just bringing systemic relaxation to her whole body, softening that tissue and breaking up if there is metabolic waste is basically removing congestion. That's the term I'm allowed to use. I'm not a doctor.
Right.
So that's the term we use in practice. And that basically is circulation, increasing circulation and elimination.
Now we're coming into the 3-minute mark, and Suzanne's still enjoying the reflexology that Victoria is rendering on her. And
Okay.
Victoria is going to sort of start to channel down a little bit because our show is coming to its end, and this has really, really been a very informative session. I hope all of our viewers have enjoyed it. I certainly have. And I think Victoria and Suzanne both have enjoyed themselves.
Yay!
Yay!
Definitely. Reflexology is a beautiful thing. Can help a lot of people.
And just to remind you, if you have any questions about today's mindful health alternatives segment, don't hesitate to give me a call here at Cat TV 802-442-8868, and I can give you some more information on how to get in touch with Victoria.
Yeah, you can email me, call me if you have questions.
Yep.
Generally, I work in Chittenden County, but you know, it's good to find a practitioner. If you go to the ARCB website, you can punch in your location and find a practitioner who's fully trained.